All right, while people are coming in, I'm just going to go ahead and get started. Hi, everyone. My name is Jana Wright. I'm the Director of Policy here at ITUP. I'm really excited for today's session because it really speaks to the history of ITUP as an organization. But again, welcome to Ensuring Health Coverage for California's Most Vulnerable Communities. We have some spectacular panelists today with us, and I really hope you enjoy it. This is going to be a little bit different from the other panel that you attended earlier this morning. We will start with a presentation by Kelly Green from Covered California, and then our other panelists will engage in a conversation. So a little bit different, but let me go ahead and get started with introductions, then I'll pass it over to Kelly. So to my immediate left, I'm joined by Camila Chavez, who's the co-founder and executive director of the Dolores Huerta Foundation. I also have Andy Imperato, who is the executive director of Disability Rights California. Faith Colburn, a new member to the Children Partnership. She's the Director of Advocacy. And then Kelly Green, the Director of External Affairs and Community Engagement at Covered California. Kelly, take it away.
Thank you. This is as close as it gets, so I hope y'all can hear me. Thank you so much for the introduction. I'm Kelly Green. I'm with Covered California. Thanks to ITUP for allowing us the opportunity to present today. Sitting among other esteemed colleagues and speakers. I was saying before we started this talk, we have had wonderful opportunities to partner with the Dolores Huerta Foundation to promote enrollment. We have Myra Alvarez, your executive director of the Children's Partnership, on our board. Andy with Disability Rights, we feel like we're in very good company today, so thank you very much for giving us this opportunity. I am here today to share some insights, updates, and information on behalf of Covered California, mainly from a coverage and access perspective, and really spending a little bit of time looking ahead to some important policy issues that Covered California is paying close attention to, particularly as it relates to the ability of California being able to access coverage and care. So I would like to begin with just a quick snapshot of the progress that has been made in California when it comes to getting people covered. Thanks to the support of numerous policymakers, consumer advocates, just an array of committed partners, we have made significant strides in reducing the rate of the uninsured in California. Covered California has served nearly 6 million consumers since we opened our doors in 2014. And millions have gained coverage under the Affordable Care Act's Medicaid expansion for adults. And when you take those two together, California has experienced the largest percentage point drop in the rate of the uninsured in the nation, which is something to be very proud of. And we continue to do more. So the state of California, for example, has made significant investments in expanding Medi-Cal. Further, by expanding eligibility for the program to all Californians regardless of immigration status. It's policies like that that will help continue to drive down the rate of the uninsured in California, and we're very happy to be a part of that effort. So quickly, just specifically with regard to Covered California, we have consistently aimed to provide quality health coverage and keeping costs as low as possible for consumers with a real heavy focus on affordability through the lens of equity and ensuring that we are reaching as far and wide as we can to get as many Californians enrolled into coverage and improve their access to care. We currently contract with 12 health insurance carriers who provide coverage across the state. Our enrollee population is comprised of low and middle income Californians. These are individuals and families who do not have access to coverage from another source. So they are ineligible for Medi-Cal because their income may be too high. They're too young for Medicare. They do not have coverage through an employer. These may be small business owners who are living their dreams, running their businesses, and using Covered California as their mechanism to make sure that they are able to remain covered and have access to care. Nearly 90% of Covered California's enrollees receive financial assistance to help them pay their monthly premium costs and to reduce their out-of-pocket costs. And so that is through a combination of federal and state financial assistance that's available that really help reduce the amount of money that people have to pay out of their pockets for their coverage and for their care, keeping it affordable and making sure that we can keep as many people covered as possible. So let's talk a little bit more about those particular federal and state investments. And we will start at the federal level. There go. Affordability matters. It matters a lot. We know that it is a primary driver in individuals and families' decisions on whether or not they will take up coverage and what kind of coverage that they will choose to enroll themselves in. In 2021, Congress and the federal administration took some critical action to increase the amount of federal premium tax credits that are available to individuals who enroll in marketplaces like Covered California. So they enhanced those premium tax credits. And as a result, the amount of premium assistance rose for all of the consumers that were eligible to receive those tax credits. The lowest income consumers, so those we're talking about people who have incomes at about $22,000 or below, were able to enroll in free coverage through Covered California. And for the very first time, as a result of this federal activity, middle income Californians became eligible for financial assistance through the exchange, which is a really big deal. So these are individuals at income levels of about 400% of the federal poverty level and above. It's about $68,000 to $70,000 for an individual who prior to this federal action had no access to financial help through marketplaces like Covered California. So it's made a big difference and brought a lot of relief to middle-income Californians and Americans throughout the country. We also have state investments that are making a big difference. Consumers, starting in 2024, individuals who enroll through Covered California can also benefit from help to lower their out-of-pocket costs to get care. We have a program that, with support from the governor and the legislature, we're able to reduce that out-of-pocket cost through what we call the California Enhanced Cost Sharing Reduction Program. It was established in 2024. It eliminated deductibles and lowered out-of-pocket costs for individuals who were at 250% FPL or below. And thankfully, with continued and increased investments, in 2025, we were able to expand the program regardless of income. So any individual who enrolls in Covered California, if you sign up for a silver plan, can take benefit for these cost-sharing reductions. And the results, we have had record enrollment. In 2024, we saw our highest enrollment at 1.78 million Californians. This was an increase that was seen across the entire state, every region, across all demographics. We saw highest increases among Latino and Asian Americans in particular. We actually just closed our 2025 open enrollment just last week. It was on the 31st. And we are proud to say that we reached an all-time high at 1.9 million Californians who selected a plan during the open enrollment period. We'll have more up-to-date data on that once we have some time to spend with that data. But again, it is in California and nationally, we're seeing record numbers of enrollment, and we know that the affordability piece matters a lot to people being able to sign up when they need it. I'm going to mention very quickly, because I don't want to take up too much time from the panel, a couple of programs that we have put into place under the auspices of state support here. So first, Covered California has been able to implement a program called Medi-Cal to Covered California Enrollment Program, or as we affectionately call it, the M2C program. This is based on legislation from 2019 that enables Covered California to automatically select a plan for individuals who are coming off of Medi-Cal and who are eligible for Covered California. So creating a seamless transition for them where those consumers, when they lose their eligibility for Medi-Cal, can very easily and seamlessly transition into Covered California if they are eligible and if they have no other source of coverage. We implemented the program right at the time of the end of the public health emergency and the Medi-Cal unwind that California underwent in 2023. Following the first year, so during that unwind year, we saw nearly 520,000 individuals who lost Medi-Cal coverage and who were automatically enrolled in a plan through Covered California. And through the program, about 30% or over a third of them confirmed their coverage with us. They effectuated their coverage, which is actually a much higher effectuation rate than what we see in our traditional population, which we take as good news and an indication that the individuals were able to make that transition, that there's a need for coverage, and that it remains affordable to them. We also wanted to mention a recent expansion to DACA recipients within Covered California. So recent federal policy change expanded Covered California eligibility to DACA recipients for the very first time. It's important to note that in Covered California, under federal law and rules, undocumented individuals are not able to apply for coverage through Covered California, nor are they eligible for any financial help, which leaves a pretty significant gap in reaching those who may need coverage but who would not be eligible to come through Covered California. So last year under the Biden administration, the definition of lawfully present was amended to include DACA recipients. So that enables Covered California to expand and extend coverage to DACA recipients in California. We implemented and launched the program on November 1st. We estimate that there are about 30,000 individual DACA recipients who would be eligible and may take up the coverage. Of course, this program comes at a time of great uncertainty, as we've discussed quite a bit today, and there is pending litigation in other states challenging the rule change, and of course, with all of the uncertainty with regard to federal immigration policy, there is a bit of a dampening effect in this program. So we are continuing to work very closely with community partners, state organizations, immigrant advocates, to ensure that we are, number one, educating ourselves in terms of how best to reach this population and inform them of this expansion. Two, monitoring and tracking what is happening federally and making sure that we are up to speed and understand what implications might be here in California. And three, communicating outward to DACA recipients to make sure that we are working and providing information to them that meets them where they are at. We will continue working with these organizations on this effort, and it's important to know now that despite litigation, despite uncertainty, the program is open and DACA recipients are able to enroll today and gain access to coverage and care that they might need. I am getting close to wrapping here, but I definitely wanted to mention today a key priority for Covered California and for marketplaces across the nation, and that is making sure that we are keeping coverage affordable and able to continue to serve vulnerable populations. I mentioned enhanced federal premium tax credits. It is a temporary program. This is the enhanced tax credits are set to expire at the end of 2025, which means come 2026, with less money available for consumers to use to help them pay their premium costs are going to increase. I'm not going to go through all of the remaining slides here because I think it will take too long, but I definitely want to highlight a few key things here. With the enhanced premium tax credit set to expire, we do expect Covered California enrollees to experience substantial premium increases, or their cost of the premium. On average, Covered California enrollees could see premiums increase by over 60% in 2026. More than 1.3 million low-income Californians could see their costs for premiums go up by about 60%, and more than 1 in 3 of those low-income could see their premium costs double in 2026. Those middle-income consumers who for the first time were eligible for financial help would no longer be eligible for any financial help, bearing the full cost of their premiums on their own, which could be costly, and that's about 150,000 middle-income consumers. There's more data here. We would see significant increases among communities of color. We would project that for Latinos, their premium costs would go up about 76%. For Black African American enrollees, 67%, and over 70% for Asian enrollees. So it's a very significant change that we may see coming forth. And as you can imagine, when premium costs go up, affordability diminishes. People aren't able to keep their coverage. And currently we estimate about 400,000 fewer Californians would be projected to stay in or enroll in their plan. That's about a decrease of 25%, which is really significant given the amazing progress that we've made. We don't want to lose that. These slides here provide greater detail of what I just explained. I want to end here, and while certainly there are a lot of risks that come with losing our enhanced premium subsidies, there's a lot of work to do that we need to engage our DACA recipients for our expansion program. We are committed and pretty tireless to making sure that we're engaging in these conversations and that policymakers, consumers, members of the public have important information and data that they can use to make good decisions on behalf of consumers. So we are not an advocacy organization, but we do ensure that we are a part of the dialogue and informing that dialogue, and we will continue to do that. I will close by just saying we cannot do it alone, and Covered California's success has been largely based on its partnerships, whether it's federal, state policymakers who are supporting the work on behalf of consumers, consumer advocates, health insurance agents, community-based organizations that are out on the ground enrolling people. We have such a strong network of support across the state of California, and we appreciate that, and we will be continuing to work with you, particularly on enhanced federal tax credits, but just all of the issues that Covered California is working on generally to support vulnerable populations, to keep coverage affordable, to improve health equity, to address health disparities, and all of the efforts that we're here together to make sure we're serving people in the best way we can. Thank you.
Thank you so much, Kelly. Can we give her a round of applause? That was amazing. Thank you. Thank you so much, Kelly. Really appreciate you running through all of that data. Now we can get started with some panelist questions. Kelly gave us a lot to chew on, but I want to think we've heard a lot about equity over the past 2 days now. We've heard a lot about what's at stake. We've heard a lot. I think we're well versed in all of the things. We're well versed in the nearly 15 million Californians who rely on Medi-Cal. Let's talk about, during times of fiscal constraints, how can California's leaders maintain a focus on health equity, and what innovative approaches to funding or policy design could sustain progress? So I'll start with Camila.
All right, good afternoon. Can you hear me okay? Alrighty. So I want to share a story about when COVID hit. And as you know, we were all in crisis, right? And the Dolores Huerta Foundation worked with Building Healthy Communities, Visión y Compromiso, I see their leader here, Maria Lemos, and others who served a Punjabi community, the Mixteco community. And we went to our public health director and we said, we want to help. And they said, great, we need your help. We put together a plan. It was a $2 million contract, and when he took it to the Board of Supervisors, they turned it down. And the reason that they turned it down is because members of our group, of our diverse, and progressive CBOs, had posted, defund the police and Black Lives Matter. And so the Board of Supervisors said, we're not going to give these groups any money when they have values like that. Well, the DOJ came after them years later, just last year with a stipulated judgment. But other groups saw how important that was, and this was a huge funding, a lost opportunity, right? So the help that was ready was delayed. And so for me, I think, especially with these funding constraints, right, that community members were on the ground, were ready to help. And so to come up with, there are programs in place that are funding community-based organizations, and I feel like those need to be expanded, right? We're already there in the communities, we're part of these communities, and so that is one way that I'll contribute today.
Thank you so much. Andy, we'll go next to you, and feel free to react to anything Camila said.
Sure. Well, thanks for having me. Am I coming through okay in the back? So yeah, I think from a disability perspective, I'll just point to some things to be careful about as we try to figure out how to navigate a difficult, both political and fiscal environment. One is having a healthcare system that is going to work for people when they need it the most. Sometimes we try to provide quote unquote basic care, and then when somebody finds they need long-term services and supports, or they need access to specialists, they can't get it. So trying to have a system that accounts for that is important. That's not a good place to save money. And I think there's a way to make a case for that to conservatives and liberals, because a catastrophic thing can happen to anyone. So part of it is educating them about what's out there now and why it's important if you find yourself in that situation. Another thing that I think is important to recognize in California, we've had an expansion of involuntary interventions with people with mental health disabilities, first with Care Accord, then SB 43, which expanded the definition of gravely disabled. Proposition 1 has money in it to pay for locked facilities. All of that is expensive. So if we're trying to have a healthcare system that is efficient, doing carceral involuntary stuff is not efficient and not effective. So I think it's worth revisiting. Why are we so quick to go to carceral solutions to challenging behavioral health issues? And then, part of it too is just having a healthcare system that recognizes that there are a lot of people. I live with bipolar disorder. There are a lot of people with disabilities who are comfortable as disabled people. They see disability as a natural part of the human experience and not as a thing that has to be erased or mitigated necessarily. So just being open to that and having a healthcare system that's open to people with disabilities being comfortable living a full life with their disabilities and not trying to help the healthcare system correct for their disabilities. Disability is a diverse category. How that plays out is going to vary dramatically. Certainly the deaf community is not, by and large, interested in having a healthcare system that's going to erase their disability, although there's still a lot of healthcare institutions that are focused on that. Lastly, I'll just say accessibility, and recognizing that accessibility costs money, paying for sign language interpreters, having captioning, language access, all these things are important, and it's important to maintain budgets for those things and not have those things fall by the wayside when we're in a tight fiscal environment.
Absolutely. Thank you for all that. All right, Faith, we'll head to you next.
Perfect. Thank you. Everyone hear me okay? Hi, everyone. I'm Faith Colburn. I'm with the Children's Partnership. And for those that don't know, we're a statewide advocacy organization focusing on child health equity, and specifically how things like access and coverage impact immigrant families and children of color. So I want to echo the sentiments of both the panelists. I think for me, a budget is a reflection of our values, right? And so in this moment in time, I think that California's leaders and all of us in this room that work at sort of different parts of the continuum of services or advocacy have a really important role to play, to stand proudly and loudly with our communities of color, with our immigrant families and community members, with undocumented folks, with our LGBTQ plus family, that we shouldn't shy away from those, in my opinion, right? Of course, we need to be strategic, and I think we need to be stealthy in some ways, and also I think that we should be clear about what we stand for and what we're a part of. And so a part of that, I think, is in this moment in time, what I would share with our leaders is that to not be too prescriptive and say, this is what our immigrant communities need, right? Or this is what the queer community needs. But instead, we should be creating space for those folks to come into the conversation and lead those policy solutions and really be at the center and close, because they are closest to the solutions. And what we're hearing from folks already is, one, in addition to things like access, is stability, especially in times like this, ensuring that things like coverage under Medi-Cal. Kelly talked about some of the flexibilities that were afforded during the public health emergency, and we saw that those worked. We saw what happens when we keep folks covered. And so there's policies like that. There's things that we can do while we're still playing the defense, right, and defending our folks, that we can focus on continuing to protect and expand the expansions we've already had in California.
Thank you, Faith. All right, this has all already been so good. Okay, but I'm going to ask a specific question for each of you. So, Camila, I want to start with you, though. I want to know, tell us more about CBOs and how they can play a role in health equity. We have so many lessons learned from the COVID-19 pandemic. We saw community step up. We saw community turn themselves into vaccine clinics, turn themselves into public health experts overnight. How do we leverage the power of CBOs in this moment in time?
Yeah, and thank you for talking about your organization, because I did not. Dolores Huerta Foundation, we do grassroots organizing. We're based in the Central Valley. Our headquarters are in Bakersfield, and we work mostly with farm workers, but also BIPOC communities. And So I think as far as, and I feel like the state of California is doing a really good job, and I felt like the COVID crisis really, helped kind of solidify this structure of, these direct, contracts and partnerships with community-based organizations, and also like tracking results, right, and like what's working and what's not, and so I just want to give kudos, to our the state departments that are making that happen. And so with COVID, right, we were able to really grow. And so here we are now, with promotoras and outreach workers really expanding their knowledge and being in those communities, right? The mobile health clinics, taking those vaccination clinics to those to schools, to churches, and I feel like we need to just continue that, right? So we're hearing all these statistics of how, and even right now, right? So a lot of people have heard about the immigration rates, right? And so we know that there's been a decrease in food banks, there's been a decrease of people actually seeking, going to their medical appointments. And so what are the things that we can do? In the earlier panel, right, I was suggesting like a volunteer kind of network, right, to take to transport people, or there's this talk of telehealth, right? But so many of the rural communities just don't have the digital, access, right? They don't have the actual devices, and if they do have the devices, then the Wi-Fi is really, But I think just being able to work with the organizations that are in those communities, bringing people together, asking, what works for you. And so currently, we're partnering with Kern Health Systems, right? That's our local provider, and they said they were worried about the Medi-Cal re-enrollment because it wasn't going to be an automatic like it's been in the last, during the COVID years. And so we're just keeping up with the same strategies in the communities at, swap meets, right? We set up booths at swap meets to talk to folks, but unfortunately with the rates, swap meets, are really empty right now, unfortunately. So I think it's those kinds of things. I would love to see more mobile clinics. I feel like I couldn't get enough. It was really hard. Just bring doctors to us, bring these providers to us, and that is something that I feel that there aren't enough of.
Yeah, and it seems like we're doing a better job of that for schools in particular, because they'll have the mobile clinics for vaccination, immunizations, and then also for dental services for kids. Thank you for that. All right, Faith, I'm going to jump over to you. Yeah, you've had a busy little time over at TCP. So we know that because Prop 35 was passed by voters in November, it rolled back some investments, including ensuring continuous health coverage for kids 0 to 5. Talk to us some more about that, why it's critical, and what actionable steps we should be taking in California to make this a reality for all children. I'm going to add another part of this. And what can we in the room be doing to help you?
Of course. Thank you for the question. Okay, well, just want to take a quick step back. So Kelly sort of alluded to it, but during the public health emergency pandemic, we had what's called continuous coverage, amongst other federal flexibilities, to ensure that folks that are eligible stay covered, right? And so without those flexibilities, oftentimes folks will fall off of coverage, not because they're not eligible, but because of administrative hurdles, right? The paper wasn't filed at the right time, or they did send it in and it magically disappeared, right? So, things like that were getting folks kicked off of coverage for months at a time. And specifically for children, families weren't finding out until they were in an emergency situation, right? They were in, an ER room, right? And discovering that they no longer had coverage. So again, under the public health emergency, folks stayed on, and so really sparked our interest of, well, let's keep doing that, right? Particularly for young children, because we know that 90% of young children's brain development happens before the age of 5. It's such a critical time in a child's development, and also a really important indicator of future health outcomes as well. And additionally, Medi-Cal covers half of our children in California. Just to be clear of who we're talking about, 5.5 million children are on Medi-Cal, and 3/4 of those are children of color. So again, in talking about, when we think about systematic racism and systematic barriers, this is the operationalization of that in many ways for the healthcare system, and particularly for young children. So again, we went to the legislature and through the budget process secured funding to make sure that children could stay on for the first 5 years of their life if eligible for Medi-Cal. And yes, unfortunately, that funding was rolled back, as well as other spending and sort of budgeted allocations, like to your point, for community health workers and promotores. And so we are working hard to get that funding back, actively working on a budget campaign. Just today, Assemblymember Borner agreed to be our Assembly champion. So that campaign is very, very active. And so to your point of what the folks in the room can do, you'll see a lot of us, you'll see a lot of me shouting from the rooftop how important this is. And so there's so many opportunities, I think, to elevate, again, to my earlier sort of point, specific stories of children and their families. We want to make sure that children and families are at the center of this. And the reason we're pushing so hard is because we heard directly from families that this was so critical, again, to that stability piece. Particularly in a time like now, right, where someone might not want to go into a county office and give their personal information, right? So we see it as an immigrant justice issue, again, as a health equity issue, and we hope we can get it across the finish line this year.
Thank you, Faith. All right, we're gonna go to Andy for a final question, and then I'm gonna ask for just final comments, and then we're gonna go into Q&A. Sound good for an agenda? Yes. Okay. You were supposed to say yes or like not or something. I know it's the afternoon session, y'all, but come on. All right. So, Andy, Kelly talked a lot about affordability. We know that we are facing an affordability crisis, not just on egg prices, but also for housing as well as for healthcare. If the enhanced tax credits go away at the end of this year, that's going to even further exacerbate what we're seeing with our affordability crisis in California. So I'm tying this into the essential health benefits process. Would you like to talk more about this process and what specifically is needed for communities living with disabilities to thrive in California, and frame it to just the affordability piece of it all?
Sure. I mean, I think I was trying to get at that when I was talking about what is the health coverage that people have. We don't just want people to be insured, but we want the insurance to work for them. And for a lot of folks that have disabilities and chronic health conditions, it's hard to get what they need, whether it's a particular wheelchair, assistive technology, access to a specialist, when something breaks, getting it replaced, just having basic access to the facility can be a challenge. So all of that needs to be kind of baked into what we mean by essential benefits. The definition of essential or the definition of medically necessary can get played with in a way that discriminates against people with disabilities, or defined in a way that works for people with disabilities. Just one story from the pandemic that I want to share was the fight that we had around access to ventilators. I don't know if you remember, the California Department of Public Health put out guidance that said when you're in a scarcity situation, you don't have enough ventilators, it's okay to not give the ventilator to somebody that's too old or too disabled to benefit from it. And we pushed back on that. Both Justice and Aging, Disability Rights California, and others said that's discriminatory and it's illegal. And the California Department of Public Health, to their credit, changed their position. But the fact that a progressive Department of Public Health would think it was okay to put that out there in the first place, to me is just a sign that there's still this idea that in a crisis, disabled people and old people are expendable. And I just think it's such a dangerous way of thinking about how you get through a crisis. And that same kind of ideology can affect how you define essential benefits. We'd like to do that, but that's a Cadillac and we can't afford a Cadillac. But for people that actually need those things, it's not a Cadillac, it's essential. So I just think it's important to have a robust conversation about what that means and how to promote equity in a way that actually works for everyone. And if everybody has to take a hit because it's a financial crisis, I think it's also worth asking the question, why are we having a financial crisis? What are the bigger macroeconomic issues that are resulting? I came back to California after 26 years on the East Coast, and what amazes me about our state budget is when rich people do well in the stock market, the whole state has money to spend on poor people, And when rich people don't do well in the stock market, poor people suffer. That's not an equitable way to finance human services. So I think we need to have a broader conversation about why are we all okay with that.
Thank you for that. So right now the state is deciding on some essential health benefits. So durable medical equipment would probably be top of the list for our friends.
Durable medical equipment and assistive technology more broadly that helps people live with dignity with their disabilities.
Thank you. All right. Okay, final comments before we dig into Q&A. So, but be quick. 20 seconds, can you do it? I think so.
I'll just say that, because we work so closely with farm workers, that many people don't know that only 50% of farm workers actually have some type of health coverage. They do not get, health insurance through their employer unless they are unionized. And that, these community health centers are just so important, right? A lot of farm worker women have fertility issues. 37% of the male farm workers have a chronic illness, while 47% of female farm workers have at least one chronic illness. So as we think about our next meal and think about the meal we just had and all the yummy vegetables and fruits that we've eaten throughout the day, right, I'm always keeping the farm workers in mind. Thank you so much.
Thank you.
Yeah, I'll just bring up a comment that Marcela Nunez-Smith made when we were working on the health equity task force during COVID. She said our job as a task force was to disrupt the predictable patterns of who will be harmed first and who will be harmed worst in a pandemic. I think there's a parallel in the political crisis that we're in right now. In California, we have a responsibility to disrupt who will be harmed first and worst in the crisis that we're in right now.
Thank you.
And I would just say that community is everything right now. And so our folks on the front lines, our community health workers, promotores, our CBO partners, we need to uplift them. We need to find ways to fund them and sustain them. In addition, we need to make sure that folks on the ground have accurate information to make informed decisions about their care.
Thank you so much. All right, so this session is unlike others because you got a wonderful presentation from Kelly Green, and I'm gonna give you some homework. So earlier today, during our lunch, we had a Mentimeter, and someone bravely put organized action, the very first one. So today's your lucky day. Aren't you so glad you came to this session? Because I'm gonna give you 3 things that you can be advocating for. Continuous coverage for kids 0 through 5, not 2 5.
0 to 6, technically.
0 to
0 through
6,
5.
technically,
Yeah.
but 0 through 5. Also, enhanced tax credits, ensuring that Congress does not, if Congress does nothing, they go away. So we need Congress to act, and then get involved in the essential health benefits process. It's moving quickly, so I would encourage you to do that right away. All right, questions and answer. All right, to the left. Hi.
Hello? Yep. Now we go.
Thank you. Hi, Jane again.
Hi.
My question is for Andy and everyone in the room. I'm just so, it's so appalling to hear what you just shared with us. So my question for you is how do we make the invisible disability visible? How do you make people cognizant about the struggles? Because any disability is not not all are visible, let's put it this way. And people tend to stigmatize because you see one is, like what you see, oh, I'm walking with a cane, maybe something wrong with my feet. But I have more than that. So how do I make people cognizant that, because I'm an advocate, I've been doing this for years, and yet people choose to, she's fine, she's younger than me, and blah, blah, blah. But really think about it. How do we put a strategy to make them cognizant of those of us who have challenges in regardless of mental, physical, or learning? Thank you.
Yeah, thank you for that question. I think that's the strategy to address that is going to differ in different cultural contexts. Some cultures have a lot more stigma around disability than others, and it's important to recognize that. to me, the idea that disability is a natural part of human diversity is important. And you know, in my own organization, when I started 5 years ago, less than 30% of our staff were self-identifying as having a disability. Now it's close to 50%. And I think part of that is because I've strongly encouraged people to be out and open with their disabilities. It's all voluntary, but I think sometimes professionals feel like it's a mistake to admit any vulnerability because it might make people think less of you as a lawyer or less of you as a professional. And we have to address that head on. Our lived experience with our disabilities makes us better at what we do as professionals, not worse. We had the blaming the plane crash last week on, you know, the diversity efforts of the FAA. That's a teachable moment to push back and say, no, the FAA is stronger when they have a diverse workforce, including people with disabilities, and that people don't get hired to do jobs that they can't do just because they have a disability. That's not the way the ADA and other laws work. So I don't think there's a simple answer, but I think part of it is people being out and proud with their disabilities. I think we can learn from the LGBTQ movement and other movements that have been able to do that over time.
I just want to say, let's start by correcting with the word, not disability, differently able. Thank you.
Yeah, it's interesting. I feel like part of our job, as long as the word disability is our civil rights word, it's in our civil rights laws, is to make that word sexy. Kind of like the word queer. It's a political word that we can own. I know that a lot of people think it has negative connotations, but we can change that. So I would say be open to that word having a different meaning over time.
Thank you, Andy. Other questions? Or comments. You could, if you like comments, that could work too.
Well, I'm happy to bring up a question for my fellow
Yeah, go
panelists.
ahead.
I feel like this moment feels a lot like the very beginning of COVID, in the sense that our world has been turned upside down very quickly. We don't know how long it's going to last, and we don't necessarily have something that happened in the past to prepare us for this. This doesn't feel like Trump 1.0, and I'm just wondering if my fellow panelists are feeling that way, and if you have thoughts of things that we did during COVID that might help sustain us through this time.
It's a great question. I think I totally agree. First and foremost, I think the level of confusion, right, the sort of unprecedented nature of this moment in time, it's a lot. And I think as advocates, everyone in this room cares deeply about these issues, or you wouldn't be here, right? So I know that it's on the hearts and minds of everyone in this room and at this conference. And so I think for me, as an individual, as a human, that's one part, right? Trying to bring it back to the human level of recognizing that this is a marathon, not a sprint, right? And so thinking about how we can sustain ourselves in the work, how we can sustain, again, our folks on the front line, our colleagues, our peers, our friends, our community, and really, really leaning in to our small circles to make that big ripple effect. And obviously, you know, we all are in here, we're doing system change, we're fighting for policies, and that's important. That changes hearts and minds too, but also making sure at the most human level that we're taking care of ourselves during this time and the folks that we love.
It's interesting because I've heard some people say, you know, surviving the next 4 years. And for me, I don't think it's going to be 4 years. I think the damage is going to be so long term, right? And so, and a lot of us have been saying like this whack-a-mole approach, right? It's this, it's that, and that. It's, you know, there's a lot of chaos and confusion. And so it's really hard to stay focused. And so I love, you know, what Secretary Johnson was saying this morning, right? Is being focused on what we need to do. But I think also now, but then also for the future. So they're taking away all these things now, but what does that rebuilding look like, you know, after this administration, right? What's the next administration? And so what are those things as far as rebuilding? And, you know, I will bring Dolores Huerta, our president, into this conversation because she is 94 years old. She's going to be 95 in a couple of months. So she has lived, you know, history. She has survived, you know, the Nixon presidency, Ronald Reagan as governor and then president, the Bushes. You know, she was beat up and almost lost her life protesting Bush Sr. When he was running for president. And what she says is that, you know, it's times, these dark times, where it is really our moment to organize and to mobilize and to strengthen the movement, right? And so a lot of us, we work in silos. We're, you know, community-based organizations that have beef with the other, you know, organization or that other person, and time to let all of that go. Right, this is not time to keep those grudges. I mean, we really need to unite and come together.
Thank you for that. All right, I feel like I should now respond to that question because it was so good, and even though I'm not a panelist, but if you'll allow me, I was in D.C. the week of the inauguration, and D.C. has never felt colder than it did when I was there, despite it was 17 degrees, so it was physically cold, but very, like, spiritually cold as well. I think we have to be very thoughtful about engaging our members in Congress, some of which are going to be up for re-election in 2026. It's 2025, that's a year away.
Yes.
A little over a year away, but it's coming. Like what was said earlier, we're already seeing cracks within the party, so it feels like there are some places where there are vulnerabilities that we could push. And I think, too, we have to enter rooms with data from the district. We have to enter rooms with language that they will understand and recognize. I cannot talk to a Republican congressional member about, thank you, Shirley, about equity. That's not going, it's going to go completely, they're going to completely block me out. But I have to say that equitable care is quality care. And if we just have to make a language switch for the time being, let us do it to get the work done. We have to keep our eye on the goal. And I know that we all are very attached to the word equity. Obviously, it's in our conference, and it's a conference title and also a big part of our organization. But just want to empower you to say, if you need to make some language switches, it's okay. You're still staying true to the people that you're serving. You're still staying true to the Californians who need your help. To Faith's point earlier, keep filling your own cup, whatever that looks like. I recently took up ceramics. My team knows this, and January was a great month to start ceramics. I'm no good at it all, but it's okay. I'm really enjoying it. So whatever fills your cup, whatever helps you get out your anxieties, your fear, your anguish, go do that thing. The world needs you. California needs you especially. But as California goes, so does the rest of the nation. I know you've heard that before today, in fact. So we will continue to be California despite the federal administration, and I encourage you to continue being you in your work and upholding our communities, particularly our immigrant communities during this time. All right, any other questions before we wrap? We've got some time. Any final comments you want to share, panelists? I know I already asked for those, but anything that we didn't touch on you would like to share?
I think just quickly to sort of plus one on your comments and yours as well about sort of the cross-sector collaboration. I think it's really important to find the right messengers for certain audiences, right?
Yes.
So, you know, we do a lot of Medicaid defense, right? Or well, now we're doing Medicaid defense, but protecting the Medi-Cal, right, in California, and thinking about, you know, to your point, I'm not going to go to maybe a Republican congressperson and, you know, beg for them to understand the merits of Medi-Cal, but what they will understand is the hospitals coming in and telling them about the impacts across the system of care, right, and the health plans. And so I think we need to be strategic and intentional about those sort of cross-sector, you know, sort of conversations and coalitions. I think that is the key to changing the narrative and reclaiming the narrative of what we want it to be.
Yeah, and to your point, make friends with people we haven't traditionally made friends with. You know who else benefits from Medicaid? Sheriff's associations. Substance use disorder, opioid epidemic. How are they fighting that? It's Medicaid dollars. So make friends with people, be in community with people, Andy, I think you were going to say something.
Yeah, I'd just say from 26 years in D.C., including working on the Hill for a Democratic chair of the Health, Education, Labor, and Pensions Committee, I think you can work with Republicans by being your authentic self. You don't have to stop being who you are to try to build a relationship at an individual level with Republican members and staff. And if you try to pretend you're something you're not, it actually can get in the way of the relationship. So I feel like when you get past rhetoric and start talking about real people and actual constituents, it can make for a conversation that has more potential to be a breakthrough conversation where they look at an issue differently. So much of the debate is at a surface level. It's around ideology. If you can bring it down to actual people, the ideology starts being less important. So I just say, be authentic and be open to building a relationship with people who you would think would not be open to it.
Absolutely. All right. I think that's all the time we have today. I really appreciate you for being engaged. Thank you. Thank you to our wonderful panelists. And to Kelly. Thank you. Hope you'll continue to engage with us. Go get some coffee, and then we'll head on to the plenary. Thanks for being here. Y'all are great.